Hello everyone, welcome to my channel. Today we have another psychology and psychiatry step 2 question. If you would like to see more step 2 questions, please like and subscribe. A 27-year-old woman visits her primary care physician because of recurring physical and emotional symptoms that interfere with her daily routine. About 1 week before each menstrual period, she develops abdominal fullness, breast tenderness, headaches, fatigue, irritability, increased appetite, and strong cravings for carbohydrates. She also notices a temporary decline in sexual interest. Once her menstrual bleeding begins, these symptoms improve within a few days and completely resolve before the middle of her cycle. She reports experiencing this pattern for several years. As a teenager, she completed counseling for depression and has remained emotionally well since then. She denies persistent sadness, loss of interest in hobbies, sleep disturbances outside these episodes, or suicidal thoughts. She takes no medications, physical examination is unremarkable, a pregnancy test is negative, and laboratory evaluation, including a complete blood count, metabolic panel, and thyroid function test, is normal. Which of the following is the most appropriate next step in evaluating this patient? First, we need to make the diagnosis. The patient has both physical and psychological symptoms that start a week before the menses and end a few days after the cycle starts. And the physical symptoms include abdominal fullness, breast tenderness, headaches, fatigue, irritability, and on the psychological side, on the emotional side, you have irritability, fatigue, increased appetite for carbohydrates, and decreased libido. With that being said, this condition is likely PMS, premenstrual syndrome. And with that being said, we can go over the answer choices and choose the right one. Recommend pyridoxine, vitamin B6 supplementation. Vitamins don't work for PMS. B. Recommend vitamin D supplementation. Again, vitamins do not work for premenstrual syndrome. C. Prescribe fluoxetine only during the luteal phase of the menstrual cycle. Well, SSRIs during the late luteal phase or continuous SSRIs can help with this condition, but we first need to make sure that she has this condition and uh, she doesn't have another condition that's being exacerbated during the menstrual cycle. D. Ask the patient to prospectively record her symptoms across at least two menstrual cycles. This is helpful for us because if she provides us with a diary of her symptoms, we can say whether her symptoms are due to some other condition outside of the menstrual cycle and they're only being exacerbated during the menstrual cycle, or whether the condition is PMS. So I would say D could be a good answer choice. E, begin cognitive behavioral therapy. There are mixed evidence when it comes to the usefulness of CBT in PMS, but some people do it. But in our question, we first need to make sure that the condition is actually PMS. F. Start daily fluoxetine therapy. As mentioned before, both continuous, daily, and late luteal phase SSRIs can help with PMS, but first we need to be sure that she has PMS. With that being said, I'm gonna choose D as the right answer choice. Thank you very much for watching, and don't forget to like and subscribe.